Hi everyone, I'm very happy to have with me one of our dear students, Dr. Chirag. He secured an amazing rank 51 in INICET May 2022. So heartiest congratulations Chirag, you've done amazingly well in the exam. कैसा लग रहा है?
Thank you, ma'am. I am not able to believe that I have scored this rank. First thing, I have checked my result many times, and I am feeling very nice that I was able to score this.
That is absolutely true कि कभी-कभी right on the first go नहीं believe होता है and I've heard many toppers say कि वो अपने friends से भी check कराते हैं result मम्मी
I
पापा
have
से
done
भी
this.
करा.
I have
You
done
also
that.
did that?
Yes, ma'am.
Great. अच्छा Chirag, I'm sure this journey hasn't been easy, है ना? And Chirag has been a 4-year student with us. He had joined us in his pre-foundation year itself. So Chirag, अगर मैं आपको बोलूँ अपनी journey के बारे में बताओ बेटा, है ना? From starting your preparation to getting rank 51
Yes,
in
ma'am.
the Central Institute exam, and that too when the paper was atypical.
Yes, ma'am.
It was not a conventional paper. How do you feel about it?
Yes, ma'am. I just want to say that from very first year of MBBS, I always had a clear insight in my mind that I want to be in Central Institute someday. Because in UG exam also, I just a few ranks away, I was from the AIMS. So
Okay.
I had that thing in my mind that I want to be in Central Institute in PG if I can. So I started preparing early. Most of the seniors recommended that you have to start for your PG preparation in third year, and you can relax in first 2 years of your MBBS.
Right.
But that was not what I did. I even in first year of MBBS I tried to make notes on my own. From second year I joined DAMS pre-foundation direct 4-year course. So that was clear in my mind, and I was never a student who is like very fast, who is very talented, who can gain everything, who can recall, who can revise very fast. I was a very slow, like just a tortoise. I need a huge amount of time to learn the things, to grasp, and then I was a slow reader. So in initial part of my preparation, my ranks were not that good as others were getting, who were like I can say a very brilliant type of students who can recall and who can revise very early. But I never gave up, and I kept on doing and just believing that one day I can, because also they have given us 5 years to study. So I was that in my mind, if I keep on doing that, one day I will be able to get into that zone in which I will be able to get a good rank. So that worked out for me, and that constant motivation was there in my mind on, and that guidance from DAMS I can never forget. I have watched almost every motivation video of Dr. Sumer and you that was on DAMS Delhi channel. So to be part of this interview was my a dream come true for me. I always have watched those interviews from other toppers, and now I am sitting here. This is just a dream come true, and I'm truly thankful to God and my parents and to the DAMS family for this.
That's very kind of you, Chirag. Thank you so much, बेटा. But मैं बताना चाहूँगी that I still remember Chirag from the classes. ये बहुत सारे doubts पूछता था.
Yeah.
He always had doubts. और अगर आप थोड़ी सी break भी लोगे, उसमें भी he would come up. But I think आज भी Chirag, when I was giving, we went live to talk about the NEET PG strategy. उसमें मैंने exactly यही बात बोली थी कि even if you are not a top ranker, even if you think you are average, even if you think you are a tortoise, मगर अगर आप इस बात को एक्सेप्ट कर लो एंड देन यू थिंक ऑफ वेज टू ओवरकम इट, देन यू कैन डू इट. एंड आई थिंक यू आर अ ट्रू एग्जाम्पल ऑफ दैट कि आपने जो भी आपके बारे में आपको पता था आपने उसको एक्सेप्ट किया एंड देन यू टुक इट एज अ चैलेंज रादर देन सिट aside and cry about it. And I think you've proved yourself to your own self, not to anyone else. और आज के बाद से आपको ये नहीं बोलना है कि आप एक टॉर्टोइज हो, शायद वो आपके लिए एक बेनिफिट रहा है बिकॉज यू न्यू दिस अबाउट योर सेल्फ. तो आपने डबल दी एफर्ट किया एंड यू हैव कम दिस फार. सो हैट्स ऑफ टू यू चिराग, एंड आई हैव सीन यू वर्किंग वेरी हार्ड. ही यूज्ड टू टेक पार्ट इन क्विजेस ऑल्सो. और जब नहीं भी जीत पाया या सेकेंड थर्ड आया तो भी ही ऑलवेज हैज दिस स्माइल ऑन हिज फेस and he is so eager to get better than what he is, and I think that is the USP. Now Chirag, I would like to ask you कि अगर कोई बच्चा आपसे पूछे कि क्या स्ट्रैटेजी रहनी चाहिए टू क्रैक द एग्जाम एंड टू डू इट एज वेल एज यू हैव डन, तो आप कैसे क्या बताओगे बेटा उनको?
Yes, ma'am. I first of all I will suggest, many students ask me, sir, what is the right time to start? I will say this is now. Wherever you are, right time is just now. Just and the only thing that should be in your mind is that believe that you can do. Irrespective of what kind of student you are, how was your previous score, you have to believe, and just believe strongly that you can do. This belief, if there is there in you, then you can do. If I can do, then you can also do. I can guarantee this thing. And then after, once you have this belief, then what next you have to do, I can explain. Like once you are in second year, third year, at that time, whatever professional you are in, first of all, that professional subjects, like in second year I started with DAMS. So in that year I was taught second year subjects, patho, pharma and micro. So what my strategy was, whatever was taught in the class on weekend, I took all the whole week to study those notes apart from what was going in my college. Sometimes it happened in that week I could not able to read the notes fully. Then also I didn't give up. I studied them the next week. The day will come when you will complete those notes, and the feeling that you have on that day, that will be great. And what after notes? After notes you have to solve the questions, because if you don't solve the questions, then you can never understand on which topics you are lagging. Solving the questions is must. Many students just read notes, and that is a blunt thing, that is a passive thing. What is the purpose, what is the main trick behind the success is the active learning. And active learning can be done by teaching. If you can teach someone like teachers do, they know everything. How do they know? They teach actively. And other thing is solving questions, because DAMS question bank is that great, every small topic they have touched upon. So if you solve questions even in second year, if you are doing patho, you have to solve DQB of patho. If you are doing pharma, you have to solve DQB of pharma. Like that you have to go about. So and then subject wise test. Once you complete subject, suppose in 3 weekends DAMS complete patho, then after 3 weekends they take a test, a class test or something, then you have to give that test also. Even if you are not able to do good in that test, then don't lose the hope. Many more such tests will come, but you have to do, and you have to keep on analyzing your score. That way you have to go in second year. In third year also same. Once you have completed your notes in internship or in final year, that time you have to revise those notes that you have made earlier. And now is the time for GTs. GTs is the must. 2 GTs per month was my strategy in internship. Even if by part of internship of Safdarjung, which is hectic, I think, then also what my strategy was to give 2 GTs per month. Not less than that. And even if you are doing a 12-hour duty in internship, then also after the duty, just you have to do this much, that you don't sleep without doing anything. Even if you have a very hectic duty, after that in 2 hours you have to solve one question bank. For whatever topic you feel like, and like that you have to go upon. After that many rapid revisions like DVT is so great like this time, and this way you have to go about, and I can bet on that you can get the success.
चिराग, मुझे ना तुम्हारी बात में वो एक जीतने की जिद होती है ना, वो नजर आ रही है. आई थिंक वो ही उसका यूएसपी है. ये जिद जीतने की बहुत जरूरी है, और वो जब जिद आ जाती है तो आप मेहनत कर पाते हो. एंड आई कैन स्टिल फील द वाइब्रेशंस इन हिज वॉइस कि वो कितना इन्वॉल्व होके बता रहा है. एंड यू नो दैट इज व्हाई ही इज रीच्ड दिस फार. सो ही वाज वेरी ट्रूथफुल टू whatever he was doing, very dedicated. And now he's already talked about the importance of solving questions, of giving grand tests. मुझे ये बताओ बच्चे कि इंटर्नशिप में आप TND भी कर रहे थे, तो थोड़ा सा उसके बारे में बताओ कि कुछ बच्चों को पता नहीं लगता है हाउ टू कोप अप, है ना, दोनों चीजें.
Yes, ma'am.
So maybe some pointers about you on how, because there will be a lot of students this year also who are doing TND in internship. So आप कैसे करते थे? Maybe some part of your strategy they can incorporate.
Yes, ma'am. Talking about internship, if I can take the example of internship of Safdarjung, I think that is very hectic, and you can if you are in any college, you can I can explain that to you. So in internship, what my strategy was, I just started with one subject at a time. Like if I am doing ops and gynae at one time, I will just study ops and gynae. It may not work for other people, but for me, I could do only one subject per day. So what I used to do, even if it take 10 to 15 days for completing ops and gynae, but I for the first revision in that I did an internship, I did it very thoroughly. Like I was making belief that I will recall this in the main exam. Even if I'm reading in March, I will recall in INICET May 2022. So that way I was doing, and then after the 15 days I used to give TND. What I could not do was the TND schedule of the DAMS. Although I gave each and every test of DAMS, but I could not follow that schedule of DAMS because of my busy posting. Sometimes I have ops and gynae, sometimes I have medicine, sometimes I have surgery. That may happen to you also. So if you are not able to stick to that schedule, you can make your schedule based on what weak subjects you have, and that weak subjects you can analyze from GT. You once give GTs, just see your last five subjects and just do those 5 subjects first. And then while doing 5 subjects, just do in such a way that you are not leaving important things. And how you know important things? Previous year questions. So that was my strategy. If I do ops and gynae, at then ops and gynae, and then that TND of ops and gynae, and whatever I made wrong, that TND video of ma'am and whatever faculty has taken, that was enough to brush up my topic. So that way it took 9 months for me to complete 19 subject TND in internship. I started in April, and I just remember in January also almost 15 days I took, and at the same time DVT came up. So the second revision I just watch it complete DVT and the post previous year question, and then I revised DVT, and then again the TND notes, the DVT notes, and the CBTs and the previous year questions, and that way I came to this rank.
Right, and that is exactly why, क्योंकि internship में मुश्किल होता है. That is why, you know, now the TNDs are on the app. You can do it any time. The videos are also uploaded, so you can do it any time. You can go through the videos any number of times also. There is no limit to that. So that, you know, you can select and choose whatever you want to do. So वो सब app पे as a backup video library available भी है. Now tell us, beta, something about the current INICET. For example, how many questions did you attempt? How many you think कि आपके correct हुए हैं, and any specific things about the paper strategy that you want to share?
Yes, ma'am. I attempted 195 questions, and I analyzed the paper after the exam, and I got around 155 to 160 in between that correct. Okay. Because from my analysis I was able to get 25 definitely wrong. Okay. And sometimes some questions were in doubt, who were the recalls were like that, the teachers were also not giving the proper answer. Yeah. So from that doubts I can make 150 to 160 correct. So if I can talk about the paper, I can say that I thought it was a mixed contribution from all the INS. There was a part of AIMS, there was part of JIPMER also, there was part of PGI also. Yeah. So all the institutes have contributed, and the paper was atypical because this was not accepted to anyone. But what I can say, if you have studied thoroughly during your 5 years of MBBS, then definitely it will give you an edge, because what I can recall few questions from ops and gynae that were directly from ma'am's notes, and if I had not I have not done those notes, I would not have make them correct, because it was not like that I had studied those notes 1 month ago, 2 months ago. I may have studied that in that time of TND when I was doing an internship, but I could recall at that time of paper because I had done that well, and ma'am's voice also echoed in my ears when I was solving the paper. So paper was like that. So what is important if you want to crack INICET is that you study right now in whatever year you are, and make your concepts. If your concepts are strong, then how much difficult is a paper, it will give you an edge. It will definitely give you an edge. If a paper is easy, then that may not be favorable. But
Acha, Chirag, also some students may want to appear for the November INICET. So anything that you would especially want to highlight is a must do for INICET exam? Previous year questions, I think this time also they have repeated around 15, I will say 10 to 15 questions, direct repeats. 2 or 3 questions I can think that they have not even changed the statement. They have directly given what was in the previous year. So previous year is must to do. So topics repeat is very frequent.
question.
Yes.
So if you have are doing previous year questions, make sure you read that topic also. So if you are doing class notes and those topic from class notes, and the class notes are too good of DAMS that how much depth they ask, that will be covered. And I felt this in this exam.
चिराग, अच्छा 1 week के बाद NEET PG एग्जाम है, and I think Chirag भी, are you going to give the
yeah definitely ma'am.
So but still Chirag, I would like to ask you कि इस 1 week में आप क्या करने वाले हो?
Yes ma'am.
जो आपको लगता है कि definitely would help you
yes
you
ma'am.
know, in NEET PG.
So that this 1 week plan, what I am going to do is this, that I am just focusing on previous year questions of the NEET and also DVT, because that has been made from previous year question and most of the high yield topics. And while doing that, if I feel some topic I need more information, then I go back to class notes. So this is way, and I am trying to touch all 19 subjects. That is what I am trying in this 1 week, so that I'm not going without reading any subject. And one day back, if I say that day also, what I will be doing is previous year questions again, and the most frequently asked topics and DVT.
Right. So I'm going to wish you all the very best, Chirag. और जाते जाते I want to ask you, what branch do you want to pursue?
Ma'am, I want to like I am okay with any clinical branch, if I say particularly, but I always had a wish that I can be in part of some INI. So I have to yet to decide what branch I can take at this rank.
Fair enough. I do understand. So I wish you all the very best, Chirag. And anything in the end, something motivating that you want to say from your side that has worked for you as well?
Just one thing, if I want to give, I want to give a message to all, that just believe in yourself and make that fire, you know, inside your heart, that you can do. And your friends might come and say, just enjoy, why are you studying like that, just take 1 day off or something. And that had happened to me also, and sometimes I always felt that I am losing socially, I have no many friends, these many things have happened to me. But I always had that dream in my you know, back of mind, that one day when I make this true, the friends will come to me, and then I will make more socialized, because that is not the person that I was showing to people, like I am not socially interactive. Actually I am. So even if you are lagging in those things, just don't feel bad about it. Keep continuing, keep going, the success will be yours. So be passionate enough. And if you are that, irrespective of your intelligence, you will make out. This is what I want.
I think that is very, very sweet of you, Chirag. और ऐसा नहीं है, he's a very pleasant personality. He has a smiling character, and I'm sure आप बहुत सारे friends भी मिलेंगे और अच्छे friends भी मिलेंगे. That's more important. And let me tell you one thing, that you have to know that at the top, it's always going to be a little lonely, है ना?
Yeah.
So कोई बात नहीं. थोड़ी sacrifice करनी पड़ती है, but I am sure everything will come to you at the right time. And it is very important to set your priorities. That is what he was trying to say, कि in setting your priorities, you may lose on some things, but it is going to be worth it. So I think very, very beautifully said, Chirag, and I wish you the best in life. और अब बहुत अच्छा करो, and I wish कि NEET में आपकी बहुत अच्छी रैंक आए. लास्ट डिजिट को हम हटाएंगे, चिराग.
Yes, ma'am, I will try for that.
तो आप जो भी कर रहे हो बिल्कुल ठीक कर रहे हो. Have faith, have confidence, and I wish you the best. Thank you so much for making us a part of your journey.
Thanks a lot, ma'am. Thanks a lot. Always a pleasure.